Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended. And today we are discussing this routine NS3 cataract in a 58-year-old gentleman. A bit of arcus is there. So the side ports are created with this 20 gauge MVR, a bit of phenocane is injected, and then the capsule is stained underneath this air bubble. The dye is washed and 1.4% sodium hyaluronate is injected to maintain the anterior chamber. The striplanar incision, barely nicking the limbal vessels, is created. The Sinskey hook provides the counter traction. And now 5.5 mm of rexus is being attempted. The flap is created with the help of the cystitome. Now this flap is then continued with the help of this utrata. It is an excellent tool, gives a lot of control while doing the rexus, and I have made marks on this utrata by my own at 2.5, 5 and 5.5 mm, which helps me keep a check while I am making the rexus. Now the hydrodissection is being done. A jet of fluid is injected underneath the anterior capsule and the nucleus rotates nicely. This is Catrax 3 phaco machine. We will be doing a direct horizontal chop with the help of the karate chopper, which has a blunt tip and a nice cutting inner edge. So the nucleus is held firmly from the subincisional area. The karate chopper goes to the far periphery, is brought towards the probe and then laterally separated, and we have got a nice crack. So this is the ideal density to learn direct chop. So now again making a good purchase, good hold, and then chopping the heminuclei. Now we have 4 quadrants. And then the other heminuclei is then held and then chopped. So now we have 4 pie-shaped quadrants which can be easily emulsified. If you wish, you can further sub-chop them, but then with this Oatley's 2.8 mm tip, these quadrants just disappear in no time. Now I need to keep in mind that the endothelium is kept safe. So I am working in the central safe zone. So now one heminucleus has been emulsified, and now I decide to again recoat the endothelium. This is a good step which I believe everyone should do while doing grade 3+ cataracts. And now I have switched my chopper with the dialer, so it's easy to maneuver in the eye. Now the 3rd quadrant is emulsified, and in no time we are done with the nucleus management. The parameters are reduced and slowly this last piece is emulsified. And that's it. And now is the time to remove the cortex. So I use this bimanual IA, which gives me 360-degree access to the cortex. The chamber is nicely maintained and it is very safe to the anterior capsular rim and the zonules. Now we are done with half of the cortex and then switching the hands, and that's it. Now the time to inject the IOL. This is a hydrophilic IOL. The leading haptic goes in the bag and the trailing haptic is dialed in. Now the patient had 1.25 mm of against the rule astigmatism at 180 degree. So I have made this OCCI, opposite clear corneal incision, which will reduce around 0.5 to 0.75 mm of astigmatism. And now the chamber is nicely washed and the wounds are hydrated. I hope you like this video. Do like and subscribe to my YouTube channel for more such videos. And let me know in the comment section what you do if there is a against the rule astigmatism of 1.25 to 1.75. Do you go for OCCI or something else?